Well, Congress is meeting this week to hammer out a sweeping overhaul of how health care is offered and paid for in the U.S. We are joined right now by the chief executive, one who has skin in the game. Allan Miller is founder, chairman, and CEO of Universal Health Services. UHS operates acute care hospitals and specialized health and procedure centers across the U.S. and in Puerto Rico. Good morning, Mr. Miller. Glad to have you with us. Compromise looks likely in D.C. There's a group of senators trying to find this common ground on the issue of giving the middle class America, the option of joining a government health plan or not. What is your best case scenario as far as this plan goes?
Good morning. The public option really is a two-step over towards the government taking over the system. If you recall, in 1994, Mrs. Clinton had this program, and she went to eliminate the insurance companies immediately. And that was too drastic, and it wouldn't sell. At this point, what this administration has done is created this public option, which will now supposedly compete with the insurance companies. But it's unfair. You can't compete with the government, who has unlimited resources and can make any price they'd like. And what would happen is, when the public option is in place, in two steps. The first step, all of the insured in businesses will move over to the less expensive plan, and the insurance companies will be left with an unviable business. And so in two steps, you'll have what tried to be accomplished in 1994. The public option is just transparent for the government moving into taking over the insurance and eliminating the insurance companies. There are 1,300 insurance companies now that provide insurance in the healthcare field.
So what do you see as the best case scenario? I mean, there are co-ops that exist in certain parts of the country that seem to be run successfully. Well,
if you look at Blue Cross is a nonprofit. I've heard them talking about nonprofit having nonprofit. Blue Cross is nonprofit. And the House plan that just came out the other day is 852 pages. So people are going through that. But I think if they focus on the public option, to me, that's the major part of it. The rest are various details. I think that should that not be in the Senate version, then I think we could work around covering uninsured, dividing it up by the different portions of the uninsured, do something on malpractice insurance and liability. That would be a great boon to the doctors and the hospitals, and eliminate defensive medicine. There's a lot of things that could be done, but the program, as we're discussing it now in the U.S., is this public option, and will it eliminate and change forever the whole basis of competition?
The argument, sir, is that the rest of the country, taxpayers, are essentially indirectly paying for insurance companies' profits, as things stand now.
Well, let's put it actually how it works. That is correct. Insurance companies make a profit. But you also, at the same time, have to state that Medicare and Medicaid grossly underpay the providers. They underpay the hospitals, and they underpay the physicians.
By about 20%, would you say?
20 or more. 20, I think, is a very modest number. And the only way that physicians stay in business, and the only way that the rest of the providers stay in business, is that they negotiate with the insurance companies. And if the insurance companies are eliminated, then you'll have what they have in Europe. You'll have a government system. It will try to underpay, and at that point you wind up with rationing, and you wind up with the system that they have in the UK, which we have found to be very deficient.
Mr. Miller, we have to leave it there. We thank you for your time. Allan Miller, CEO and chairman of UHS.